Now to a major admittance of failure at the CDC from the head of the agency herself, Dr. Rochelle Walensky, saying she's making big changes following what she calls some, quote, pretty public mistakes during the pandemic. Walensky's announcement affirms many Americans' mistrust of the nation's leading public health care agency nearly 3 years after the first pandemic shutdowns. Now the CDC is fighting to regain that trust as it faces new cases of monkeypox and polio. But as we will continue to do here, keeping everything in context, those health stories cannot compare to the global impact of coronavirus. Joe Khalil live outside the CDC in Washington to explain what mistakes Walensky is referring to exactly and what she plans to do to fix them. Joe?
Yeah, well, she's calling for a complete reset, Adrienne, a full overhaul of the CDC. From Rochelle Walensky, it's pretty remarkable, and it's sort of a very stark self-criticism of her own agency when it comes to how they dealt with COVID-19 and how they're currently dealing with monkeypox. And she made that message clear in a video that went out to employees of the CDC all across the country, including in the CDC office here in D.C. behind us. Here's how she talked to the Associated Press when describing the CDC's response to COVID from the beginning and throughout. She says here, quote, "It's not lost on me that we fell short in many ways. We had some pretty public mistakes. So much of this effort was to hold up the mirror, to understand where and how we could do better." Now, all of this comes as Walensky ordered a report be done back in April, basically reviewing how the entire agency operates in hopes that it can do better, that it can improve. So these findings from that report are now in. They just haven't been publicly released yet. But we do have some of the reported changes that may be coming down the pipeline for the CDC. One would be speeding up the process of sharing data with health officials nationwide that they can really put to good use. They want to restructure the agency's communication. That was key, trying to make its website more user-friendly for the public, creating a new executive council that would basically help set up strategies for the CDC, and establishing a new office that would just be dedicated to helping smoothly coordinate CDC policy with other government agencies. Now, again, this comes as the monkeypox disease continues to spread globally and in the United States. Important to point out, Adrienne, as you did, not nearly at the level of COVID. We're talking about 39,000 cases globally right now and about 13,000 nationwide here in the United States. But we should also mention that those cases, while they can spread to anybody through close contact, primarily are being spread right now overwhelmingly with just the gay male population. But still, the CDC is getting criticism for not doing enough testing early on, not doing enough preventative measures early on. Stop me when that sounds familiar. Those are the same criticisms that they had when it came to COVID. So they're really trying to clean this up top down in this overhaul that Dr. Rochelle Walensky is now calling for.
Yeah, and it's very dangerous to compare the situation with monkeypox to anything related to COVID, considering that monkeypox is not typically fatal. It's not spread in the same way. Joe, thank you very much. We appreciate it. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.